as ART. I'm professor in public health and infertility at University of Copenhagen, and I'm chairing together. My name is Lone Schmidt. I'm chairing together with you.
Okay. Hello, I'm Lika Chkornia. I'm from Georgia. I'm an embryologist and I'm a chair of the SIG, which is Global and Socio-Cultural Aspects of Infertility, which was the organizer of this beautiful session. So I think we all like it, and thank you to our speakers who submitted such a brilliant talk. So let's start.
Yes, let's start. And please take off your mobile phones, and when you're putting questions, please state your name and from where you are. So I'll invite the first speaker, Hila Raanani, who will talk about patient support through a mobile application improves art outcomes across all age groups. The floor is yours.
Yes. So I'm a reproductive fertility doctor from Israel, and I would like to thank you on behalf of the ESHRE committee for inviting us to present our work about patient support through a mobile application which improves ART outcomes across all age groups. And, sorry. Yes. The presentation is giving on behalf of the Embie clinic application. The founder is Ravid Israel, and the application was launched first on October 2020, trusted by more than 48,000 users by now, more than half from the US and mostly from Anglo-Saxon countries. By now, more than 20,000 ART cycles are tracked with outcome, and we identify very high engagement profile of the users. The app provides treatment support and adherence tools at every point of the ART IVF treatment, optimizes the fertility treatment with personalized connected care. By integrating basic information, providing relevant information along the cycle with community chats provided, it's empowering clinics and their patients with real-time data-driven insights while reducing a lot of administrative and cognitive load from the clinic. More insights are even being added at this moment. The demand for ART treatment is on the rise worldwide due to expanding indications such as egg freezing, third-party parenthood, age rise of first delivery, creating a real need to improve clinic workflows, digitize flow of information, utilization of AI tools to personalize patient care, as well as providing helpful information and guidance to the patients. Parallel, growing numbers of digital applications used for everyday activity with growing numbers of adults who are using these digital health tools to diagnose and manage their health issues. A very limited amount of research had been conducted until now on application impact and specifically the impact on ART results and outcome. So, we aim to assess the effectiveness of fertility treatment companion mobile application, which provide adherence tools, education, and community support in improving ART outcomes. The study was designed retrospectively, an analysis conducted using Embie mobile application database, we'll refer to EMU, between January 1st, 21 to December 22. Participants are fertility clinic patients that voluntarily downloaded the app and opted to participate in research. Self-reported data was analyzed and compared to the to the Center for Disease Control, the CDC, published in 2020. The endpoint measurements were cycle cancellation rate per age group and live birth rate per transfer, and compared it to the CDC. We chose our endpoint as 20-week ongoing pregnancy for comparable live birth rate, since this pregnancy stage is most likely to evolve to a live birth at this point. Our population included more than 6,000 cycles. Most of them were stimulation cycles and transfer cycles. We saw that around 90% of the users had infertility diagnosis, with most of them primary infertility, as you can see here. More than 50% of them had combined multi-factor infertility diagnosis. When we looked at the users, we divided them to 4 age groups in order to be able to compare to the CDC. You can see here the CDC percentage by age group, and you can see the user groups that are significantly younger than the one participated in the CDC publication. This allies with or explained by the tendency of younger women to use digital tools these days. When we looked deeper for cycle characteristic of our users, we noticed that a significant portion were fed, frozen embryo transfer versus fresh. This was even more significant for US users. And when we compare PGT cycles, also we saw very significant tendency in the US to include PGT cycles in transferred embryos. So one of our aims were to compare the cancellations, and these are the main causes for cycle cancellation. And you can see that the biggest portion, of course, is low response to the stimulation. We can see that by growing age, the response is getting lower and significant by age group. So when we looked at our results of the stimulation cancellation rate, we saw that it was significant lower for users for each age group, and it was up to 50% difference, which is very significant. This was also very more significant when we looked at the USA users, and for the transfer outcomes as well. We saw significant of 35% for every age group, that for positive transfer outcomes compared to published in the CDC. So along our preliminary work, we saw that the users, Embie mobile application users, experienced lower rates of stimulation cancellation than in the CDC. The users showed higher ongoing pregnancy outcomes than the CDC. Patients were reporting feeling of more organized and taking more active role, being more in charge of their treatment. And we saw high patient engagement. This may be one of the causes that may lead to higher treatment compliance, less anxiety, and better outcomes. Also, the importance of diversity of data collected on a global basis and not by a single clinic might contribute more to our understanding of and improving ART cycles. But future studies should aim to understand the specific contribution of a mobile app to improve the outcome. This is the first patient self-reported data enabling analyzation of global ART treatment outcomes. Our results suggest that a fertility treatment mobile application can significantly improve patient journey and ART outcomes. We think clinics should consider adopting such tool as an adjunct care. Such an application contributes to the ability of patients to stay informed and more confident, less anxious throughout the treatment, and might significantly reduce burden from clinic. The ability to collect and analyze big data globally in real time will impact future ART research, medical understanding, and improvement of patients' fertility treatment and outcomes. I would like to thank you for letting us do this presentation, and we will be more than happy to collaborate for future and better IVF cycles. Thank you.
Thank you for this presentation, and the paper is now open for discussion. Yes, please.
Thank you very much. Congratulations for your mobile application. It's very excellent. So I'm Budi from Indonesia. So the question is about number one, about how do you make a validation, data validation, and also verification of every patient that downloaded your mobile applications. And then the second thing is also how do you convince the secure data security? Do you store the data in the server or in the cloud base, something like that? Thank you.
So about, I did not go into detail how we analyzed. Of course, we will be more than happy to explain whoever is interested. But the data is collected into the app, and the app knows how to recognize when a cycle stops, either with a negative beta or with a miscarriage, or ongoing after 20 weeks from the transfer. And all the data was collected and analyzed by our data scientists. We have a big group of former Army intelligent scientists, data scientists, and it was validated according to all the statistic tools that is known. We will soon publish our data, and it will all be mentioned there. And the second question.
Second thing is, how do you convince the data security?
So we are following the regulation rules, either of Europe and the HEFA and all the regulation that is provided. People also consent when they put their data, and all the data is secured via the regulatory of.
Okay. Thank you very much.
Thank you, and that's the next.
Hello, I'm Dr. Jessica Azuri from Lebanon. I'm here. And I wanted to know how you could explain the lower cancellation rate. Like, I would go with the hypothesis that if the patient is less anxious, that might have better success rate, but the cancellation rate is like the ovarian response. So how do you explain that?
Yeah, sure. It's a very natural question because we don't change the women. It's not women that are more fertile than the average population. But we really think that what contributes to the better results also contributes to the less cancellation, because when a woman is more integrated into her treatment, understand more, less anxious, all these factors might reduce the number of people forgetting their injections, not doing it on time, starting to think that maybe if they did another protocol, they have done better, and abort the cycle. And I think that this is something that we will now go deeper and try to study why it happens. This is the first thing that we saw, but it has to do with the compliance, the less anxiety, and also you don't miss out. If the app raises a red flag, hey, your progesterone is starting to go up or your LH is elevating, be aware. And so this is things she can discuss with her doctor and maybe change things. And
Sorry, time is over. Thank you very much.
thank you very much.
Next.
Next speaker is Catherine Stewart, and she will be presenting co-development of ORCHID mobile application for supporting fertility intentions and reproductive choices.
Thank you. Hello, yes, my name is Catherine Stewart. I'm a research assistant within the Institute for Women's Health at University College London, and I'm here today to talk about co-development of ORCHID, a mobile app for supporting fertility intentions and reproductive choices. So just to start, I've got no conflict of interest to declare. So I just wanted to give you a little bit of background about our project and the app that we have